Good afternoon, this is Dr. Do again. This video is on alphabetic list problems, still on letter C. Today I'm going to talk about it's not a specific disease, but it's just the continuity of care. We talk about the healthy well-being. It's a realm of psychological well-being and physical well-being. So in terms of the continuity of care, it really refers to both. For the physical well-being, for example, there's some acute conditions like, for example, acute appendicitis. After the surgery, the removal of the appendix. So this is a one-time acute event and done. But for many other chronic diseases, for example, the diabetes, hypertension, the hyperlipidemia, these kind of conditions, of course, it's the chronic process, and a lot of chronic diseases need the care of continuity with your physicians. So these are including from head to toe. So for those people with these conditions, follow up with physicians regularly, the routine base, and make sure everything is monitored under closely supervision, especially for heart disease, for example, the arrhythmia. Arrhythmia is a very special disease that a little higher dose, a little lower dose, or a little psychological stress or excitement will cause this, disturb the already maintained regularity of your heart, and then need to readjust the dose, readjust medication. So this is the significance of continuity care in terms of physiological physical well-being. This the meaning for continuity really is improve the mortality, improve the and really limited the serious complications if you follow the physicians regularly. On the other hand, psychologically conditions, especially actually psychological conditions, emphasizes continuity is not less than the physical well-being. So for example, postpartum blue versus postpartum stress syndrome, distress syndrome. Postpartum blue is short term. So after you deliver a baby, the mom just adjusting the new lifestyle with the baby, with the responsibilities and hormone change back to normal. So in a couple of weeks, it's recovered. So this is like a short, acute event. You do not need to follow up with regularly or as a continuity. However, if the postpartum distress, postpartum distress syndrome, postpartum depressed syndrome, that's what I mean. If that's the case, then you really need, beyond a time, it impaired your life in the long run. So that is the case, really emphasize the continuity care. Why? You think probably, oh, I will treat it as the same as postpartum blue. I went to see the physician, prescribed medication, I took it, and I feel better now. If the postpartum depressed syndrome occurred, it's not as simple as it sounds, because you probably took medications, you recovered. But this is the pattern. Eventually, after the medication stopped or paused, there's some other event triggering, so probably this will trigger another depressed episode. So follow up with the physicians. The physician will guide you whether you can continue the medication, whether you can change another medication, or whether you can stop the medication. So in terms of the continuity care, really, either your primary care physicians or the psychological counseling or the specialist. The specialist is also like one example is the cardiac arrhythmia. So that's really emphasize the continuity, very sensitive, the heart rate from regularly controlled, and suddenly there's some event happening in your life, or you're undergoing distress, or will change. Everything has to start from the beginning to readjust. the same of any other chronic disease, endocrinologist, renal nephrologist. And for chronic disease, for diabetes, for example, you're probably very happy and your exercise is maintain the same level, and then you took a certain amount of medication or insulin, for example, and regulated very well. Suddenly you want to change your exercise level, or you travel, or you probably distressed, or in your life there's some event happened, then all of those seems a very insignificant event will trigger a big change in your medication, in your health, and physically well-being. So the point is the psychological subtle change event in your life that will have a big impact on the physiological well-being. So this is what I mean, the significance for continuity care, either psychological counseling, regularly see the specialist, or the physical well-being, follow up with either primary care or the specialist to adjust according to your life event, lifestyle. For example, the hyperlipidemia seems so, probably that's the only problem you had. You do not have any other comorbidities, no diabetes, no hypertension yet. So you're on a statin medication, you're happy, the cholesterol under control, and suddenly you find there's a special restaurant, really tastes good, you like it, and you enjoyed it, and then also at the same time you decrease your exercise level. So after you stop the medication, you thought everything's under control, then you go back to the previous lifestyle, or no exercise, eating some food which contain high amount of lipid. So that's you can imagine what will happen next. And next time during the physical, you went to the physician after the blood drawn, lab came back, your cholesterol sky high again. So this is what I mean, the continuity. Not only the medication, the physicians advise each time, either a psychologist, or the psychiatrist, or primary care, their advice each time is inspiration or encourage. For example, very simple, straightforward, everything seems fine, but I still want to emphasize as a physician, exercise, eating healthy, continue with, you're doing good job, continue with your good job. So this simple last conclusion word will impact your life if you follow the physicians regularly as a continuity of the care. So this is the significance I meant to say, to put in this video, because sometimes we all have those moments. Okay, I'm doing good, I don't need a medication, I don't need to see the physician. But this is the ideal, the best way is to continue with your physicians, either specialist or the primary care, to maintain the well-being psychologically and physically. So that's the video for today, and I thank you for watching. I will see you next time.